Hi, my name is Esgar Guarín. I am a family physician and a surgeon vasectomist. I work in Iowa in the United States. COVID had made things very different, certainly. In my regular medical practice, we had to adjust to the changes caused by coronavirus. We had to have a clinic that was dedicated only to those patients with respiratory symptoms, and we had to use gear to try to protect ourselves. Specifically with the vasectomies, we had to make changes as well. We had to use the gear, we had to use protection on a constant basis, and the use of PPE was definitely necessary. Initially, we saw kind of a steady number of vasectomies. I really didn't have any major changes, but eventually the state of Iowa put a restriction on the number of procedures that we could do locally. So elective procedures had to be canceled, and for approximately about a month to a month and a half, we couldn't do vasectomies. After the restriction was lifted, I've seen an increase in the number of the vasectomies. What the reason for that is, I really don't know, but it is very interesting to see that now patients are coming back. Some of the patients have shown more interest on actually taking care of their reproductive health. And the reason is because they see that the current state of things in the world makes everything very difficult for them to raise their children. Perhaps the coronavirus pandemic was that extra push that they needed in order to make that decision. Well, it is extremely important that we maintain the safety of the patients. Even though vasectomies are a very simple procedure and it takes me 10 to 15 minutes to complete a procedure, I try to maintain the social distancing with the patients. I try to keep adequate protection with PPE. When my patients do their registration online to come for the vasectomy, they sign an agreement saying that they will bring a mask to the visit. We're keeping all the partners, as much as I would hate to do that, but we keep the partners outside of the office. The idea is that we reduce the transit of patients in the office. I see one patient every 30 minutes, which allows me to clean up the room, clean up the area, and minimize extensively the transit of patients in the office. I have an air purifier with an UV light in my waiting area, which for the most part is empty because the patients come in and immediately are put in the procedure room, they get the procedure and then they leave. But we've done those approaches and I think they're working. Vasectomies are an elective procedure, certainly. But in many cases, it could be an elective procedure that could have major consequences when a family has difficulties using other methods of contraception. So vasectomies might still be necessary in many cases. So what we need to do is we need to keep everything as safe as possible. Screen your patients when you talk over the phone with them. Ask them if they have had any respiratory symptoms. Ask them if they have been in contact with any patients or any other people who might have had coronavirus infection. Make sure that they come by themselves. Make sure that they have a mask when they come in. Make sure that you're using a mask at all times. Make sure that there's a complete compromise on behalf of the patients and yourself to maintain everything as safe as possible. You can do additional things like screening the temperature of the patients when they come in and ask them questions again. Don't be afraid to refuse a patient because the patients have symptoms. And just don't be afraid of canceling a visit or procedure if the patient has symptoms. Remind the patients that they can do that and be a little bit more flexible with that. I think those are basic safety measures that will help you continue with the vasectomies in a safe and protective environment for you and your patients.